You know that jolt of fear? That split second when, like, hot coffee splashes or someone touches something scorching?
Oh, yeah.
Your heart just leaps, and that little voice shouts, "Quick, what do I do?" It's especially true when it's someone close, family, maybe a colleague at work, anyone you care about.
That initial panic is definitely real.
But honestly, having even just the essential know-how can make such a difference in that moment.
It really can. Calm things down a bit.
That's exactly why we're doing this deep dive today. Think of this as your simple, reassuring guide, a quick skills refresher on the absolute essentials of first aid for burns and scalds.
Yep, covering both adults and kids.
Our goal, just to help you feel confident and capable if you ever face this kind of situation, whether you're at home or maybe in a small workplace setting.
Makes sense.
So to put this together for you, we've gone through quite a stack of resources. We're pulling key insights from really solid first aid manuals and also some recent research that looks into the best ways to cool burns.
Yeah, comparing different methods. It's all distilled right here for you.
And our mission really is to take all that info, strip away the jargon, the unnecessary complexity, and just give you the core actionable knowledge.
Simple and clear.
Exactly. We want you to walk away from this feeling prepared, able to act effectively and, importantly, reassuringly in a burn emergency. We're focusing on the practical steps, the things that really make the biggest impact.
Okay, let's unpack this then. So before we even get to the burn itself, the first aid manuals really hammer home something fundamental, your safety. Why is taking that second to make sure you're safe the absolute priority?
Well, simply put, you can't help someone else if you become a casualty yourself.
Right. Seems obvious.
But it is. It sounds simple, but in that moment of panic, it's so easy to forget. The guides talk about controlling the situation, looking for hazards like, is the source of the burn still a danger?
Good point.
Then assess the situation quickly and then protect yourself first so you can actually help. Some guides even use an acronym, CLAP. Control, look, assess, protect. It's a good reminder. CLAP. Okay, and tied right into that protection step is infection control. This is something the sources are incredibly clear on, like it's non-negotiable.
Oh, absolutely. If there's any chance you might come into contact with body fluids, disposable gloves are a must.
Right.
They specifically recommend latex-free or nitrile gloves, because of potential allergies. It's just a fundamental barrier. Protects you, protects the person you're helping.
And they even cover the details, like how to take them off properly afterwards and get rid of them safely, ideally in like clinical waste bags.
Yeah, because preventing infection right from the very start is so key to promoting recovery later on. That's a step you take before you even touch the injured person. Makes sense.
Okay, so with those foundations covered, safety first, gloves on, let's actually define what we're dealing with. The sources say burns and scalds are pretty common injuries.
Very common.
Burns are typically from dry heat, so touching something hot, fire, even friction.
Exactly. And scalds are from wet heat, things like hot water, steam, maybe hot fat or oil splashing up.
And it's not just heat, is it? The sources list other causes too.
Right, quite a few actually. Extreme cold can cause injuries that look and feel like burns. Freezing temperatures or touching frozen objects, even refrigerants.
Okay.
Then you've got chemicals, acids, alkalis, strong cleaning products, industrial stuff. Incredibly dangerous because they can just keep burning on contact.
Oh,
and electrical burns, whether from, a faulty toaster at home or something much more serious like power lines or lightning. Always need extreme caution there because the damage you see might not be the whole story. There could be internal injuries.
That's a scary thought.
It is. And even radiation, like severe sunburn, which most of us have experienced mildly, or UV lamps, even x-rays that falls under the burn category too. It's a really broad spectrum.
Okay, so lots of causes. Now, to figure out how serious a burn is, the sources give us a way to classify them based on how deep they go into the skin.
Yep, the depth is key.
The least severe is superficial, sometimes called first degree. This just affects the very top layer of skin, the epidermis.
Right, the outer layer.
It's going to be painful, look red, maybe a bit swollen, definitely tender. You might see tiny blisters, but the main thing is those nerve endings are right there, very much intact, and letting you know about it.
Ouch. Then you move to partial thickness, or second-degree burns. These go deeper. They get through the epidermis and into that layer underneath the dermis.
Okay.
These are usually intensely painful. The skin will look raw, swollen, and you'll typically see blisters, proper blisters, often filled with clear fluid. The manuals really highlight a significant risk of infection and shock with these ones.
Right, more serious. And here's a critical point, maybe a bit counterintuitive, that the sources bring up. Full thickness burns, or third degree. These damage all the layers of the skin, sometimes even muscle or bone underneath. But because they're so severe, they actually destroy the nerve endings.
They might initially be less painful than a milder burn.
Exactly. Don't let that fool you about how serious it is. The skin might look, well, charred, black, white, maybe waxy or dry.
Yeah, really damaged appearance.
And these burns carry a very, very high risk of shock and infection. Major injuries.
Definitely. So understanding the depth helps gauge how bad it is, but that immediate action, often the same regardless of depth initially.
Okay, let's unpack that then. The most crucial immediate step. Once you're safe, you've got your gloves on, the absolute priority is cooling the burn.
Yes.
Why is doing this immediately so critical, according to these sources?
It does two main things, really important things. First, it reduces further damage. It literally stops the burning process from going deeper into the tissues.
It stops it in its tracks.
Pretty much. And second, it provides really significant pain relief. The faster you get that cooling started, the more tissue you potentially save, and the less pain the person experiences right then.
Makes total sense. And what's the number one method recommended across all the sources we looked at?
Running water. Simple as that. Clean running water.
And the duration is key here, isn't it? It's not just a quick splash under the tap.
No, definitely not. The consistent advice from the first aid manuals is a minimum of 20 minutes. 20
minutes minimum.
Wow.
Yeah. And what's fascinating from that research paper we looked at comparing cooling methods is that if treatment starts fairly quickly, say within 30 minutes of the burn happening, cooling might actually need to go on for more than 20 minutes to get the skin temperature down effectively.
So longer could be even better if you start soon.
Potentially, yes.
Yeah.
That duration really, really matters. Don't skimp on the cooling time.
That research also mentioned something about the water temperature itself, didn't it? Like the tap water temp influenced the cooling effect.
It did. So while the general advice is just water or running water, cooler tap water obviously helps more. But, you don't want it ice cold either, because that can cause other problems like hypothermia, especially with big burns or on kids.
Right. A balance.
Exactly. Which brings us nicely to the next point. Yeah, here's where it gets really interesting, practically speaking. Because running water isn't always available, is it? Or maybe it's just not practical. What if you're nowhere near a tap, or using running water could make the floor slippery and hazardous, say, in a small space or an ambulance?
That's a great point. And that's where the alternatives mentioned in the sources come into play. Some ambulance services might use specific tea tree oil products, for example.
Okay.
But the pre-moistened burn dressings, like the water gel product that was highlighted in one source, those are a really key alternative.
Water gel. Okay. How do these work differently than just putting a dry bandage on?
Well, they cool differently. Running water cools mainly by evaporation, right? Like sweat cooling your skin. These gel dressings work mostly by convection. Think of the gel like a heat sink. It absorbs the heat from the burn and holds it, transferring it away from the skin into the gel itself.
Okay, so it draws the heat out.
Exactly. It gives controlled cooling and also provides pain relief. And a huge benefit the sources really emphasize is that they are non-adherent.
Meaning they don't stick.
They don't stick to the damaged skin. This is incredibly important because imagine trying to peel off a dry dressing that's stuck fast to a raw burn.
Oh, awful.
It's excruciatingly painful and can actually tear away healing tissue, worsening the injury. So non-adherent is a massive plus.
That makes a lot of sense.
Yeah.
But the sources also raise an important flag, a potential downside with any significant cooling, especially for larger burns. The risk of hypothermia getting too cold.
Yes, absolutely. Particularly in vulnerable people like young children or the elderly. Historically, burn centers actually moved away from massive cold water immersion for big burns, partly because of this risk.
Right.
These pre-moistened dressings offer more controlled cooling, which is good, but even they can still pose a hypothermia risk if you're covering a large area of the body.
So there might be limits.
Yeah, you might see protocols in some services that say, okay, don't use these on more than, say, 25% of the body surface area. Or for a really large burn, maybe prioritize using them on critical areas like the face or hands and manage the rest differently.
So it's always a balance. Cool the burn, but don't freeze the patient.
Precisely. And the contrast with just slapping on a dry dressing is really stark.
How so?
The sources are explicit. Dry dressings offer zero cooling effect. Worse than that, they can actually trap the heat against the skin.
Oh, it's bad.
It is. It can make the burn deeper and larger than it would have been otherwise. Sometimes that difference is what leads to needing skin grafts later on. So cooling first is absolutely core. Dry dressings come later, after cooling.
Okay, got it. So let's try and put all this together into a clear, step-by-step procedure for managing a typical burn, drawing from everything we've discussed. What's the very first thing we said you must do before anything else?
Wear disposable gloves, always.
Yeah.
Safety first, infection control.
Got it. Gloves on. Then?
Safely remove the person from the source of the burn.
Yeah.
Get them away from whatever caused it, the hot pan, the chemical, whatever it is.
Okay, danger removed, gloves on. Now what?
Cool the burn area. Use running water for that minimum of 20 minutes. Remember, 20 minutes.
20 minutes. Got it.
If water isn't practical or available, use an appropriate alternative cooling method, like those pre-moistened dressings we talked about.
Right. While you're cooling, or maybe soon after, what about things like clothing and jewelry around the burn?
Good question. Gently try to remove any tight clothing or jewelry like rings or watches from the affected area. It's really important to try and do this before swelling starts because swelling can make them impossible to get off later.
Okay, before it swells. But there's a huge but here, isn't there?
A massive but. The sources are really, really firm on this point.
What is it?
Do not remove anything that is actually stuck fast to the burnt skin. Don't try and peel it off. You'll cause way more damage and pain. Leave it be for the professionals.
Okay, leave stuck stuff alone. And related to that, another big do-not-te.
Yes. Do not burst any blisters that might have formed.
Why not? They look like they should be popped sometimes.
They do, but they actually provide a natural, sterile barrier protecting the delicate healing skin underneath. Popping them just opens the door to infection. Leave them intact.
Makes sense. Okay, so you've cooled it properly. You've dealt with, or not dealt with, clothing and blisters. What's the best way to dress the burn, according to these guides?
The ideal is a loose, sterile dressing, preferably one designed for burns if you have it, but if you don't have a specific burn dressing.
Yeah. What's the backup?
Cling film. Yes, regular kitchen cling film. It's actually highly recommended in many first aid protocols.
So cling film. Okay, you have to explain that one. Why cling film? That seems kind of weird to some people.
It does sound odd at first, but the sources give really solid reasons. First, it's readily available in most homes or workplaces. Second, it's essentially sterile straight off the roll, especially if you discard the first few inches that might have been touched.
Okay.
Third, and crucially, it doesn't stick to the burn surface, which, as we said, avoids that awful pain and damage when removing dressings later.
Right, the non-stick part.
Plus, it's protective, it can feel quite soothing, and because it's transparent, medical professionals can easily see the injury underneath without having to take the dressing off right away.
Okay, that actually makes a lot of sense now.
Just one key thing with cling film, apply it loosely, not tightly wrapped. And remember, if the burn still feels hot and needs more cooling after you've applied the cling film, you must continue cooling over the cling film. Water will still get through effectively.
Got it. Continue cooling even with cling film on if needed. What about specific types of burns? Like, what if it's a chemical burn? Is the initial step still just cooling with water?
For chemicals, yes, but it's even more urgent and needs to be more thorough. The priority is immediate and continuous irrigation, flushing the area with large volumes of clean water.
How long for?
Minimum of 20 minutes, just like thermal burns, but maybe even longer depending on the chemical. You need to make absolutely sure you've washed as much of it off as possible.
Okay, lots of water, keep flushing, and if a chemical gets in someone's eye.
That's an extreme emergency. Irrigate the eye immediately, again, continuously for at least 20 minutes. And you have to be really careful that the water runoff carrying the chemical doesn't wash into the other unaffected eye.
Oh, good point. Tilt the head right.
Exactly. Tilt the head so the affected eye is lower. Afterwards, cover the eye gently with a sterile pad and get them to medical attention urgently. Eye burns are always serious.
Definitely. What about electrical burns?
The very, very first step before you even think about touching the person is safety. Ensure the power source is completely disconnected. Never touch someone still in contact with electricity.
Cannot stress that enough.
Absolutely not. Once it's safe to approach, you treat the visible burn wounds themselves. Just like thermal burns, cool them with water, then dress them loosely.
Right.
But the sources strongly caution that electrical burns often cause significant hidden damage inside the body along the path the current took. So even if the skin burn looks small, they are always considered serious and need immediate medical evaluation.
Right. Don't judge by the surface burn alone.
Never with electricity. All of this discussion about severity and different types brings us to a really important practical question. How do you actually know when a burn is serious enough that you need to call for professional medical help, like dialing 999?
That's critical, isn't it? Because not every minor burn needs an ambulance, but some absolutely do. The sources give us some pretty clear triggers.
They do.
Any full-thickness burn, that third-degree one, regardless of its size, that's an immediate call for help, right? For adults or children.
Yes, absolutely. Full thickness, call immediately. And for partial thickness burns, the size matters. The guides generally mention calling for help if it covers more than about 5% of the body surface area.
5%. How big is that roughly?
A quick guide is that the person's palm, including their fingers, represents about 1% of their body surface area. So 5 palms worth is roughly 5%.
Okay, that's helpful. So more than 5 palms of partial thickness burn. Call for help.
Yes, for both adults and children. And specifically for adults, when thinking about the risk of shock, some guidelines mention calling for help if a partial thickness burn is over 9%.
Got it. What else triggers an immediate call?
Any burn, regardless of size or depth, if it's affecting the person's airway or breathing. Burns around the face, neck, or signs of breathing difficulty after inhaling smoke or fumes, immediate emergency.
Makes sense. Airway is always priority.
Chemical burns, too. Whether on the skin or especially in the eye, they always need urgent medical assessment after the initial flushing.
Right. And electrical burns.
Always call for help. As we said, hidden damage risk. One pediatric source specifically mentioned calling immediately for partial thickness electrical burns covering more than 1% body surface area in children. But really, any electrical burn warrants a call.
Okay, so basically any burn that's deep, full thickness, large, over 5% partial thickness, affects breathing, or is caused by chemicals or electricity, those all need professional help right away.
That sums it up well. Don't hesitate.
And when you do need to call emergency services, say 999 here in the UK, the sources suggest having specific information ready. They sometimes use the LINE acronym.
Yeah, LINE. It stands for Location Where Exactly Are You? Incident What Happened, briefly. Number of casualties, just one person or more. And extent of their injuries, what kind of injuries, how bad did they seem?
Location, incident, number, extent, LINE.
Having that ready helps the emergency services understand the situation and get the right help to you as quickly as possible.
Now, it's definitely worth touching on treating infants and children specifically, because let's face it, that adds another layer of stress, doesn't it?
Oh, absolutely. It can be particularly distressing, both for the child, obviously, but also for the parent or caregiver helping them. The sources acknowledge this, and really emphasizing reassurance is just key for everyone involved. Stay calm yourself if you can.
Good advice. Well, the actual burn classifications, superficial, partial, full thickness, and the core treatment principles like cooling and dressing are basically the same.
The context is different. Pediatric first aid manuals often give specific pointers or slightly different thresholds sometimes.
Like those percentages for seeking medical attention we mentioned, the 5% body surface area for partial burns, or calling immediately for full thickness burns, those are really hammered home in pediatric guidance as critical triggers.
Yeah, very important for kids. And a really crucial point for children, especially babies and infants, is their vulnerability to temperature changes.
Right. They lose heat faster.
Much faster. They just can't regulate their body temperature as effectively as adults. So this really underscores that balance we talked about earlier. You must cool the burn effectively, but you have to be extra vigilant about the risk of causing hypothermia, making them too cold overall.
So cool the burn, but keep the child warm otherwise.
Exactly. Cool the burn, warm the patient, wrap them in a blanket, covering the areas not being actively cooled. Be really mindful of their core temperature, especially during prolonged cooling.
Good tip. And the sources also mentioned treating for shock, which children can be more susceptible to with burns. Is the treatment different?
The principle is the same: improve circulation. The pediatric sources often suggest laying the child down, maybe on a blanket, and raising their legs just slightly, maybe just above and in line with their chest level. Not way up high, just enough to help blood flow back towards the vital organs.
Okay, so just wrapping up the overall first aid context here.
Yeah.
The sources remind us that after providing that immediate first aid, the cooling, the dressing anyone with a significant burn should continue to be monitored closely for signs of shock.
Yes, shock is a major risk, especially with larger or deeper burns. Keeping them calm, warm, and getting medical help is key.
And in any first aid situation, really, but especially maybe in a workplace setting, the importance of recording what happened and reporting the incident is also mentioned. Documentation matters.
It does. Proper handover to medical professionals, incident reports at work, it's all part of the process.
Okay, so let's try and bring together the absolute key takeaways from this whole deep dive, your essential checklist, if you like.
Good idea.
First and foremost, after ensuring your own safety, what's the immediate action?
Cool the burn immediately. Don't delay.
Use running water as the primary method.
Yep, running water is best if available. But remember, those alternatives like pre-moistened dressings if water isn't practical for some reason.
And the duration is crucial. Don't just give it a quick rinse.
Minimum 20 minutes. Say it again. Minimum 20 minutes. Potentially longer if you start treatment really quickly after the burn happens.
Cover the burn properly afterward.
Yes, with a loose, sterile dressing. And remember that cling film is a widely recommended, really effective option because it doesn't stick, it's clean, and you can see through it. Apply it loosely.
And critically, know when to call for professional medical help. Don't try and manage serious burns alone.
Use those triggers we discussed. The depth, full thickness, the size over 5% partial, if it affects breathing or if it's a chemical or electrical burn. If in doubt, call for help.
Our aim with this, really, was just to give you simple, actionable steps, all drawn directly from these solid, authoritative sources.
Exactly. First aid, even these basics for burns, it's about empowering you, giving you the confidence to make a real difference in what can be a really stressful situation.
Knowing what to do can genuinely replace that initial panic with, purposeful action.
That's the goal, feeling prepared.
So thinking about everything we've discussed, this raises an important question, maybe something for you to ponder. Considering those slight variations you sometimes see in international guidelines about exactly how long to cool for and the different ways water and alternative dressings actually work, how do we, as first responders, whether at home or work, best navigate that tricky balance? The balance between cooling effectively enough to really minimize the tissue damage and the pain versus that very real risk of causing hypothermia, making someone dangerously cold, especially if they're vulnerable, like a young child, or if the burn covers a really large area of their body.
It's a really crucial consideration, isn't it? It highlights that first aid isn't always black and white. There are nuances. Understanding the why behind the guidance, like why we cool, but also why we worry about hypothermia, that helps you make the best judgment call in the specific situation you're facing.
Absolutely. Well, hopefully this deep dive has served as a clear, maybe reassuring guide and a bit of a refresher for you. Hopefully it gives you more confidence should you ever face this kind of situation.
And maybe, just maybe, it sparks an interest in seeking out some proper hands-on first aid training to really practice these vital skills. Nothing beats actually doing it.
Very true. Thank you so much for joining us for this deep dive into burn first aid.